So this is probably a little unbecoming. I look like Worf from Star Trek right now. It's because I'm hanging upside down in my inversion table. That's why everything seems upside down, because it is. I just wanted to talk about pain for a second. Pain. So pain is something that we would love to avoid. You know, as a society in general, we're just averse to pain. I get it. It's an uncomfortable sensation, an uncomfortable somatic sensation. So, pain is complex. Pain happens for a lot of different reasons. And, the main one is because receptors are telling the central nervous system that there's a stimulus that is noxious, is perceived as a noxious stimulus. And so, what the fuck does that mean? Well, it means a lot of things. Well, what can induce pain, right? Like, heat feels good until there's too much. Okay, cool. Cold feels good until there's too much. Interesting. Okay, let's keep unpacking this together. What about pressure? Pressure feels good, usually, until there's too much. Okay. Tension. Tension feels good until there's too much. There's even chemoreceptors, like sensors that sense different levels of chemical in the blood or in the local environment. Those can feel good until there's too much. You get what I'm saying, right? You get where I'm going with this. And so, pain is a very complex sensation because what one person perceives as an adverse pain, pain, something that they can't handle, to another person could be totally normal, comfortable, even good, even. And so I've developed a very unique relationship with pain because I've been forced to endure so much of it. And so, what I wanted to say, if I could boil this down to the most simple point I could possibly make, is that pain is just information. And it could be any number of things. Like I said, pain could be heat. So, like, I was in the sauna today for a very short period of time, and I trained arms. Not really huge on training arms just for arms, but it's extremely painful for me because my left arm has been broken 6 different bones. Left shoulder has been dislocated twice. I've had 2 surgeries of my elbow. Actually, I don't know if you can see it. Those are the pins that came out of my. Those are the pins that put my radius and ulna back together when I was 17. They're like this fucking long. And when they took them out, it felt like they broke my fucking arm again. Anyway, pain. Ooh, that was a good click. Hanging upside down here is painful. For me, just existing is painful. Breathing is painful. Loading the spine is painful. Flexing my bicep is painful. Moving my shoulder is painful. You get what I'm saying? Going into rotation, internal rotation is painful. Going into external rotation is painful. I'm in pain all the time. All the time, pretty much. Almost don't get a minute off the pain. I don't get a break. That's an interesting reprieve. That felt kind of good. So, I'm trying to unpack this in a way that might make sense for some people or help you make sense of your sensations that you're experiencing in your body. So, pain is a complicated somatic sensation. It's a cacophony of somatic information, right? And what the fuck does that mean? Proprioceptive and somatic information, right? Proprioception is the sensation of things occurring in the body. Things, forces, chemicals, etc., acting inside of us. And what I wanted to say about it is that you almost need to develop a unique relationship with your pain. You have to make friends with the demons, right? Your demons can control you, but if you can control your demons, they can be your best friends. This is really weird to talk about, right? And I'm not just saying this to be a masochist. Sure, to a point, you have to almost develop this sense of like, one of my friends calls it fetishism. He's like, you've got to, like, I suppose to a degree, fetishize the pain. And that doesn't mean like sexualize it or anything. It just means like turn it into something that you're excited about. And why is that? Well, at the end of the day, everything I put on my back is going to hurt me. Everything I put on my shoulder is going to hurt me. Everything I put, every motion I put into that fucking left shoulder is going to kill. But if I make friends with the pain, I've tamed the wolf, basically. And like, what does that mean? What does that mean? How do you make friends with the wolf? Well, you have to learn how the wolf operates. The wolf is a complicated creature, right? It's mysterious, we'll say. Basically, it's, like I said, pain is just information. And so, like in the physio world, for example, the physio will often tell you, you probably want to try to stay within about a 4 out of 10, a 3 out of 10 in the rehab process, especially when you're acute, in the acute phase of post-injury rehab. Okay? It's just flavored water. We got a CO2 can. We carbonate our own water because I think, what is that thing called? Soda fountain or whatever. It's a scam, dude. It's like $40 a bottle. If you go get a large canister and fill it up with like fire station grade CO2, it's like $20. It lasts all year. You're getting rocked in CO2 charges. Anyway, that's your choice. Be smarter than the marketers. Anyway, what I'm trying to say is, you have to make friends with the pain, because look, pain is coming for you. Pain is coming for me. It's coming for you. It's coming for the ones you love. It's coming for your friends. It's coming for your enemies. You'd hope that it's coming for your enemies. But if you can develop a unique relationship with the sensations inside of your body, now you're dangerous. Because if you can take that pain and interpret it in a way that makes it so that, like Zed say, make it so that it is useful information. And what the fuck do I mean by that? I mean, you take the pain and you understand it. You understand the motions. You understand the ankles. You understand the ranges. You understand your tolerable limits. You understand what level of pain is going to cause injury, right? Because pain is basically your body saying, if we go past this point, we're going to injure. Something's going to continue to deteriorate in a deleterious way. And there is a certain level of threshold of pain that you must endure in order to overcome a barrier, basically. And for rehabilitation, people often are adverse to pain, and they're like, oh, but it still hurts. I'm like, I hate to say this as a therapist, but this is a very real thing. Sometimes the fact is it's never going to stop hurting. It'll hurt forever. Like my back, broke it in 2016, broke T12. There's a video of that. I have since passed that number, but it took 10 years. I got a damning diagnosis for my knee. The diagnosis was so severe, I actually had to get checked for cancer. It's because it's bone on bone in the medial, yeah, I went over this once, but let's go over it again. Bone on bone in the medial compartment of my right knee. where the distal head of the femur articulates with the tibia, and where the medial patellar facet articulates with the femur. Hold on, I'm actually just checking through and see if I can find my medical records to actually find that MRI readout. The interpretation of travel receipts. So anyway, I've had to do what they call regressions. What is a regression? A regression is a movement that brings the intensity level down to a range where you can interact in a meaningful way and make progress, induce a stimulus that your body can recover from, and take advantage of the supraphysiological compensation that will therefore follow after an application of stimulus. This is difficult because obviously pain is not fun. I don't know, I think it's right here. It's not fun. Incomplete medical history. There we go. 2019, 2025. Oh man, I got medical history. Gross. Oh, the knee final follow-up consultation. Reference MRIs. Hold on, let's take a look at this. So, yeah, what I want to say about it is you got to make friends with pain. Fucking balding. That's painful in ways I can't even describe because I was a handsome devil. Thank God I'm hooked up, right? But I'm with somebody I love and we've been together for a long time. We're going to get old. We're going to get wrinkly. We're going to get fat. And we're going to fall apart. But we're going to do it together right to the end. I hope. That's the plan anyway. Ugh, Dr. Baird. I hated her. She was a bitch. Echocardiograms. Yeah, okay, hold on. Hold on. We're getting there. Where's that damning diagnosis? Anyway, yeah, so what I'm trying to say here is you will experience pain in the rehabilitation process. You will experience pain throughout your life. Like, it's just a fact. There's no escape. You can pop pills. You can run away from it. You can punch through it. You can do all kinds of stuff. There's no escape. There's no escape. So you may as well make friends with the demon, right? Because you're going to be together for a long time. Rather, you're going to be together forever. Ugh. Hideous, hey? I should just shave it off so all my bald friends say. I'm going to try to regrow it. Anyway, what I'm trying to say here is I can't find that fucking piece of paper. But you have to basically find a way to interpret the pain and find a level of tolerable stimulus that you can induce from which you can recover so that you can take advantage of the line of supercompensation. If we had plotted it on a graph, it's very clear. You stimulate and then, it's, you know, I had a piece of paper somewhere. Anyway, like MRIs of my spine. There's all kinds of stuff in there. Echocardiogram. Like, I'm a wreck, dude. But at the end of the day, you're going to feel pain. Is what it is. Every great athlete feels pain. Everybody who signed that shirt has been through some shit. I got Eddie Cohen's signature. I got Ken Cooper's signature. Both of them done double patella tear. Both of them still squat. Ed Cohen has had a hip replacement. He squatted 600 since then. Kyrgios Grizzly. He's had mad injuries. I don't know, he doesn't speak English. He's a Georgian, but he's had injuries. Julius Maddox benches 700 plus. This is a freak of a man. He's benched more than I've ever deadlifted off the floor with like a regular conventional setup. And he benches it faster than I can pull it. I'm going to be honest, I'm never going to bench 700. Shirted or whatever. I don't think I'll ever bench 7. But I don't care for shirted bench personally. But there's another guy on there, Jimmy Kolb. Jimmy Kolb benches 1,400 shirted. wrap my head around that. Can you put 1,400 on your hands and have your radius and ulna hold together? I don't know. I guarantee it hurts though. He has to get X-rays after training sessions because he has so much weight in his carpals. The chiropractor he goes to see just wants to make sure he doesn't have any broken bones before he does his next session, kind of thing. Before he does his next big one. Who else is up there? Shillelagh, Lindis Shillelagh, I think is his name. I guarantee he's had injuries. He's been at World's Strongest Man 11 times, from what I understand. Alex Charchak. He's had injuries too. I took care of him after he tore adductor magnus on the right, I believe. I'd have to ask him. But anyway, still squatting, still training, still at a high level of function. Who else? Anyway, I'm going over all these big names. Another big one, Canadian guy. Maxime Boudreau. He's torn a bunch of muscles. He tore a lat and then went and competed like a couple of weeks later. Who does that, you know? Champions. So why am I going over these big names and all their injuries and the fact that they're persevere through them? They've had a very special relationship with the sensations in their body. They have pushed the limits, past the limits, obviously, because things have exploded on them. But they've come back. And you know that process? It wasn't a free ride. It took a lot of time, it took a lot of effort. But they all have something in common. And this is their relationship with that sensation that we call pain. And so, if you can find an acceptable range, wherever your tolerable limit is, and you can explore that, I encourage you to, because remember, life is going to put you into positions where you are vulnerable. And if you cannot enter that position under control and exit it with authority, you're vulnerable as a kitten, and you always will be there. And so this is really important to conceptualize, because if you cannot make friends with the pain, it's going to be your enemy. And you don't want to have pain be your enemy. You want it to kind of be your buddy. You know, would you rather be friends with the devil or enemies with the devil? So I'm telling you, you don't want to be enemies with the devil. The devil will wipe you out. So I'm not saying this to be tough. I'm not saying this to be cool. This is serious shit. Every tradesperson, I don't even care if you're an office worker, you're going to have back pain. I don't care if you're the most careful person in the world. You'll feel pain. But what I'm trying to say is, you have to develop a special relationship with the pain, like the pain of aging, the pain of loss, the pain of injury, the pain of recovery, the pain of knowing you're past your prime, you know, and you have to take agency over these sensations in order to navigate them correctly. And to navigate them correctly means that you have taken in that information and you've done the correct actions accordingly to that information, right? You've acted accordingly to this information, because all pain is information. Like, I hate to bring this up, but the B&E Pain Olympics, if you've ever heard about that, please don't watch. Don't look it up, please. Don't. But one guy, he was talking about how there is no pain, there is no pleasure, there is only intense physical sensation. And yeah, to a degree, I think he's right. I like to label it as pain. Yes, pain. Tore off some calluses the other day, deadlifting 335 for 50. It was painful, but it was fun. It was intense. It was euphoric. I had a good time. And yeah, I'm healing up and it feels good. And you know what? I'm going through that super physiological compensatory period now. I've made friends with the pain, and the pain can be your friend or can be your enemy. But you've got to find that range of tolerable stimulus that you can handle, and you have to explore it over and over and over. Why? Well, the brain has a set of wiring, basically. And what happens is when you experience pain, there's something called cortical inhibition. So, say you got the knee pain. I've had the knee pain. This knee is the knee. This is the one I've removed 50 mils of fluid from. That's just a scratch. That's not there are no surgeries on that knee, but I've removed 50 mils of fluid myself from the Baker cyst. It was a complex Baker cyst, 2 pockets, like 28 mils of fluid from one and something like, you know, 22 from the other, something like that. Something, it was gross, thick yellow fluid, kind of yellow. Some of it's full of blood and pulls really good with an 18 gauge. Anyway, I've made friends with the pain. I got told not to squat. I'm squatting. I did a set of Bulgarians not too long ago. 200 pounds on each leg for a set of 10. That's painful. And but what I've done is basically done a regression, brought that stimulus down to a tolerable level. And what did that look like for me? Well, first it was in the hot tub. First thing, it's heat. Heat is analgesic, which means it reduces the amount of perceived pain. It also makes the tissue pliable. It also expands vasculature. So you have this flow of blood. You have this situation where the lymph can flow away from. Clearing stasis lymph is important, right? Because that's the fluid that's going to carry away the garbage. And so the blood interacts with one side of the cell. The cell takes what it needs to into the cell, right? There's receptors on the outside of the cell. They're like keys. They're like the lock. The receptor is like the lock, and then the chemical coming into the apical side of the cell. There's the basal apical side. Depending on this I think maybe more refers to like a hollow organ, basically, and then there's the basal side and then the apical side. But anyway, one side interacts with a substance, and it's got some kind of an enzyme, or it has some kind of a structural component to it, and it will unlock the lock and get accepted into the cell. This is the same with water, salt, ions, minerals, vitamins, you name it, right? And so bioavailability kind of determines what's allowed in and out of the cell. And the cell does its thing, and then the cell has to shit too, just like you. So the cell shits out all the garbage. And there's other cells too that are just they run around. So like white blood cells, they're like, it's crazy. You see them under a microscope. They're like reaching around to try to like find the offenders. And cells speak to each other through chemical mediators, right? They'll excrete things that will tell other cells to do other things. And so these are chemical messengers in your body. It's very interesting. They're like autonomous little creatures that are living inside your body, and they do stuff. And why am I telling you all this, right? Because it kind of relates back to pain, right? They do stuff, and then, that creates a reaction. So white blood cells will even go in. So when the inflammatory response, for example, critical, got to happen. Without inflammation, zit, red inflammation. So it's like the zit here. there's like a war going on, right? My white blood cells are fighting something, and they basically go into the inflamed area. And what inflammation does, basically, so cells have very tight junctions. I believe they're called desmosomes. There's hemidesmosomes, desmosomes, et cetera, et cetera. They're like different kinds of junctions with different kinds of cells, but they connect to each other very tightly. And so when you have an inflammatory response, what happens is all kinds of cells go there, and they tell these other cells to like create a small space. Whoop, I see you. And the white blood cell says, okay. Whoop, it goes in. It goes into that space. White blood cell go in. And white blood cell now, it envelops the offender, covers it up like an amoeba, basically. It's like an amoeba. And then what happens when the cell envelops the other cell is it lyses the cell. It digests the material or the offender, and it destroys it, and it basically turns it into garbage. And then whatever is left there has to be removed by the lymph. This is what your plasma and your clear fluid does. And so that has to go somewhere, right? So increasing the expansion of the vasculature in an area allows that stasis lymph to pass out of the area. And that's critical for healing because you need that shit out. The dumpster, like if your dumpster in your apartment building is over fucking flowing, which probably it is, and it smells like shit, right? When they clear that shit out, it doesn't smell quite as shitty anymore. And then you can continue to fill it with garbage, right? So your house is clean. If that dumpster doesn't get emptied, where's the garbage in your house going to go? You got nowhere to fucking put the garbage, right? Toxic environment. It smells like shit. It's garbage. So this relates back to pain in that the inflammatory response will press on nerves. It will cause, remember the chemoreceptors we're talking about. Inflammatory response talks to chemoreceptors and basically induces what's called a nociceptive perception of noxious stimulus. And that is perceived as pain, right? If you try to make friends with the pain and you perceive it as like, okay, that's a useful stimulus because that tells me that something is happening here. There's issues, there's restriction, there's tightness, there's something is not right in that zone. We can go in there and apply a stimulus. We have some control over it, right? We can apply heat, we can apply cold, so we can expand the vasculature, contract the vasculature, force fluid in and out, pumping. What happens when we pump? We're getting the dump truck to come and take the garbage out so you can take your shit and throw it in the fucking garbage so your apartment's nice and clean, you know what I mean? The cell is your apartment, and that dumpster is your lymph, basically. You got to get that dumpster empty all the time. And the cleaner, the emptier the dumpster is, the easier it's going to be for you to get your bag of garbage in there, you know what I mean? So let's break it down to its easiest components. And so why am I going into this? Because like I said, it's coming for you, it's coming for me, it's coming for you. It already came for your grandma and your grandpa. I guarantee they're hobbling around. We're all headed there. I don't care if you lift or not. We're all headed to the wheelchair. We're all headed to the bed. We're all headed to somewhere where we don't know what's next. You know what I mean? And you got to make friends with the pain because she's coming for you. And if you make friends with the pain, that's a very, very powerful place to be. That means you are the master of your perceptive sensations in your body. Not the master of, but you've got to the mature point where you can perceive a stimulus and or a sensation, and you can make sense of it. You can navigate. It's a roadmap. It's telling you what is too much and what is not enough stimulus. So to overcook is to induce a stimulus that is basically causing so much damage that it takes longer than ideal for your body to recover from. And if you've got an occupation, say for example, occupational repetitive stress injuries, basically what's happening is you're applying a stimulus to a part of the body that the body cannot recover from before you apply the subsequent stimulus. This is the nature of a repetitive movement injury, right? And if you're a tradesperson, you know exactly what I'm talking about. Tendinopathy, whatever. It's like micro trauma to the tendon, and the tendon basically, the collagen fibers become disorganized and they become knotted and they become like tied up and shitty and not well aligned. Because when they're aligned along the lines of stress, they're more able to be elastic and take that stress. You know what I mean? So they do rearrange. There is what's called collagen remodeling. There's cardiac remodeling too. Like your heart can heal from stress, but it's very, very slow because your heart it never stops pumping. But when you sleep, you know, the heart rate goes down, blood pressure goes down. There's even a system in the brain. It's called the glymphatic system. There's the lymphatic and the glymphatic system. Glymphatic system is where your central nervous system is removing toxic buildup of toxic metabolites from the brain. So the ventricles of the brain actually expand during sleep. That's why sleep is so fucking important, because the ventricles expand, cerebral spinal fluid flows into that area. The cilia inside the ventricles are doing the cilia stuff, right? That's pretty cool. It's fucking psychedelic, actually. But your brain is removing toxic metabolites. So when you wake up, you should feel way fresher, clearer of mind, able to think. And what also happens in the brain is there's structural reorganization of the synapses. So we must make friends with the pain, explore ranges that are restricted,
try to regain access to those restricted ranges under control and with some authority. And then rest. You need to rest. You know, that's the brain going through these plastic changes, right? And when we induce a stimulus, learn something, go on the sauna, have a good sleep, it raises the levels of this peptide that your body produces, basically called brain derived neurotrophic factor. BDNF is critical because BDNF is what primes you, one of the main things that primes you for plasticity. I'm not a neurologist. I'm a massage therapist. That's all my only credential. I am a registered massage therapist. We go into great detail in our education. It's actually really surprising how much education massage therapists have, but it's very also surprising how much of this stuff massage therapists don't really quite understand. And to a level that I've experienced this stuff and I'm a nerd about it and I love it. So what I wanted to say is you've got to make friends with the pain. It's going to happen. And if you can interpret the pain and act in a way that's advantageous to you, it's going to produce a positive adaptive response. This is what you want. And so let's wrap this up because this is getting really long. What I want to say is you don't want to run away from pain, nor do you want to pound into it. You want to explore it and find what's your tolerable limit. And I've had a lot of experience with this, having 16 broken bones. Remember, I told you those spikes that held my friggin' arm back together? Look at these guys. One's 11.5 centimeters, one's 7 centimeters, and that's the hook. That's the pin. That's the little thing that held them together. That put my fucking ulna back on the rest of it. That put my olecranon back on the ulna. Snapped it off. You know, I was really young at the time, and you're more plastic when you're younger. You just are. And when you get older, you become less and less plastic. This is the nature of like, that's why you get old and stiff. And this is another thing that's interesting to consider is that you can train elasticity into tissue, but you can also decondition elasticity out of tissue. So you can lose that elasticity, but remember, tissue is plastic. Tissue remembers what it needs to do. So the changes that you can have regressions and you can have progressions. So you can have positive adaptations, which will basically make you more resilient, and you can have negative adaptations, which will make you less resilient to a mechanical stimulus or a stressor, rather. And it's really tricky, right? Because different tissues respond in different ways. Joints don't heal as fast as, say, muscle. Tendons don't heal quite like joints. And everybody's body's capacity for recovery is different. Some people's capacity to heal is very low. And this could be genetic, it could be lifestyle, it could be nutrition, it could be sleep's not there, it could be repeated stress from work. It can be due to many, many, many things. But what I want to do is encourage you to make friends with those demons. Because, you know, if you must be exposed to those demons, you may as well have them on your side because they're powerful. They're powerful. It's a powerful tool. And understanding pain is a very difficult, it's a difficult conversation. It's a difficult concept because when you are always running from pain and say nothing's going right in your world, nothing's going right, car blew up, wife left you, kids are being little pieces of shit, boss is a fucking asshole, hate your job, feel trapped, you're going to perceive every stimulus as more noxious than if everything was going good in your life. And let's be serious. When does everything go good? Well, when does everything go perfect, rather, we'll say? We're always between two peaks. Always between two peaks. You have a good time where you peaked, everything's pretty good. And then right after that euphoric good time, something's going to happen. You're going to be back in the trough mode. How are you going to navigate the trough? Well, you got to be straight up and real with yourself, and you got to find a way to make it work. And so the seminar that I'm going to put on is about finding the right amount of training intensity, frequency, and volume, basically to basically optimize your exposure so that you can take advantage of the super compensation that should follow. If it's not occurring, there's something going on, right? Like rheumatoid arthritis, I'm sorry, but there's a massively reduced capacity for recovery, and this is just built into your genes, I guess. Your body is attacking itself, and this is an autoimmune issue. There's all kinds of things that you might have to struggle with, but like heat is a really good one for that particular ailment, for the reason that I just talked about, the removal of the garbage, right? Flushing, flushing is soothing. You want to get that inflammatory cascade to kind of calm down, because when the inflammatory cascade kicks up, and we have not had enough time between the peak of the cascade and the valley, it's really easy to induce the cascade again. So this was a tricky one for my knee. So if I could just relate back to the knee thing, damning diagnosis. It's so bad. There's even 2 tears in the meniscus, and there's so much mechanical damage that's occurred that my bone marrow is changing. I had to get checked for cancer. I don't have cancer, but the bone marrow is on the MRI darker than the muscle, which is indicative of a potential lymphoma. And lymphoma is not a good diagnosis. Cancer runs my family too. And I've, we'll say when I was younger, I went out of my way, not like knowingly, but not really like on purpose, to induce the exposure to, we'll say, carcinogenic compounds. But I was hooked on avoidance because I didn't like feeling pain, and I didn't understand pain very well. Now that I'm a little older and I've been through so much of it, it's pain. But now I seek the pain almost. I'm looking for it because I understand that it's useful information. And if you can use that information to your advantage, you're going to be dangerous again. It puts the power back in your hands instead of being the professional victim. I want you to be the professional workaround artist where you can find a way around it. And look, I understand there's limits. Everybody's got a limit. And it's not like everything's going to be perfect all the time. In fact, life is probably going to throw you more lemons than it is going to throw you apples, you know what I mean? But you got to be a master of making that lemonade. So at the end of the day, what's my job? My job is to help you navigate. I'm your Sherpa. I'm a massage therapist. I induce pain. That's part of what I do. But if we can get you out of those compensatory, inhibitory motor patterns by inducing an amount of pain and, say, like relieving a trigger point, for example. Trigger points are notorious for basically removing your ability to contract a muscle properly because the muscle is so bound up. There's chemical dumpster fire in there. There's sarcomeres that are like cranked together. Sarcomeres basically are the structure of the muscle which basically contracts and then lets go, and contracts and let go. And if you've got a knot in the muscle, basically what's happened is it's stuck like that. And what causes that? Sympathetic tone is one. Repeated contraction without proper elongation, and basically just the body. If things have been cranked up for so long, the body tends to say, "Hey, these structures have been approximated for X amount of time. Maybe we should just glue them together so that we don't have to like do so much work." Not exactly like that, but that's the general take on it that I'd like to take from it. But that's a good way to look at it. And so what's my job is to basically empty the dumpster, bust up the sarcomeres, and release the knot so that you're able to contract that muscle again. And what that does is it gives you access to a more silky range of motion, easier access to contraction, better force production, better velocity production, less perception of pain. Like there's a myriad of things that are positive that happen from a deep tissue massage. And if you've ever been for a deep tissue massage, it's not a pain-free experience. It's not a free ride. First of all, the session is fucking expensive. It's expensive. But if we don't go in there and do our job, you're going to end up right back at square one like 2 days later. And so my job is to bring sympathetic tone down so that you don't end up back up there, so that muscles don't contract unwantedly, because there's tonic and phasic muscles, right? Tonic muscles are the muscles of posture. They're always having some kind of tone. They like the ones in your neck. If there was no tone in the muscles in your neck, you'd be like one of the, I hate to say it, but you'd be like one of those junkies downtown that's just like, you know what I mean? You've seen them, the ones that are caved over, and you're like, how are you still standing? And they're like, You've seen it, the fentanyl. Yeah, that's a bad place to be. And there's people who are like wrecked because they've been in that position for so long that all the structures that are associated in the back there that are supposed to keep you upright have been like stretched and caved over like this in this kyphotic position. Even the lumbar range that's supposed to be in lordosis, which is like the opposite curve. It's curving the wrong way for an extended period of time, and then basically you end up crippled. And you see people walking really funny, and that's the reason. Partly that, but also brain damage, and there's many reasons, right? They could have neurological diseases that are undiagnosed, maybe mental problems that are not diagnosed. Like, and everybody walks different, anyways, right? The gait is not a straightforward thing, but yeah, I hope that helps you understand pain a little bit better. And the process of navigating pain, right, is that we need access to ranges that are restricted in order to move correctly and correctly. Like the range of the way that you move that would be the most biomechanically advantageous or simplistic and easy for you, efficient, we'll say. And you want that. That's what you want. That's what a massage does. Basically, it gives you access to ranges and positions and contractions that you wouldn't normally have access to because you've been stuck in this compensatory pattern for so long. And so I hope this little 40-minute fucking video helps you navigate those sensations a little bit more effectively, because look, at the end of the day, we're all going to experience a certain amount of pain. Some of it is going to be psychological, some of it is going to be emotional, some of it is going to be like, I hate to say it, but like on a spiritual level, you will experience pain in your life. The loss of a parent, the loss of a loved one, the loss, somebody leaves you, somebody, whatever. Just name your pain. Something's going to happen to you for sure. But we got to navigate that. And it comes in so many different flavors and so many different sizes. Like, you can get a small pain, you can get a large pain, you can get an extra large pain. Can I get an extra large pain with a side of lack of mobility? Yes, you can, and you probably will. But you could dump it too, but you have to go through those plastic changes that the muscle, the fascia, the central nervous system, everything can go through. And so I want to encourage you to explore these things. And if you must, seek help, right? Like, I understand this stuff in an intimate level that I don't think a lot of people do. Like, almost to the level of maybe a neurologist might, or a chiropractor might. And if you've not been there yourself, it's very hard to clearly help somebody else understand it through explanation, right? Explanation and language is our most effective tool at helping somebody label something syntactically so that they can interpret the sensations that they're experiencing with a deeper understanding. Because if you understand the mechanism, if you understand why something's happening, now we can reverse engineer the way out of it, right? This is working backwards from the issue. And that's my job. My job is to help you understand. My job is to get in there, put my back into it, and help you get out of pain, and help you increase your movement efficiency, your neurological efficiency, and basically regain access to all these lost ranges. But you also have a huge job when you come and see me. Your job is to do all your home care. And if you don't do your home care, and if you don't understand the issue, and you just expect me to like rub you and make it all better, I'm sorry, but that's not how it works. And if you've got the money to come in over and over and over, and you don't want to do your home care, or you don't have the time, look, I get it too. Sometimes you have a job and it's just, you don't have access to the time. You don't have any energy left. You're so tapped out physically, emotionally, and mentally that you just don't have anything left. And I've been there. I lived there I'm only 36, but I swear to God, I lived there for like most of my life. And it's a hard place to be. This is a really personal topic too, but I almost ended it. And I'm talking suicide. I almost ended it because of pain. I almost gave up. But I just want to tell you, there's ways around it. You have to I rewired my whole life so that I didn't have to sling board anymore, so that I could understand this issue and get through it. And I'm through it now, mostly. I'm still dealing with the shoulder thing, but you know what? If I understand it at this level, and I'm this professional about it, I believe I can get through it. And I think I can help you understand it to a level where you can get through it too. And so I want to just give you back the power. My job is to give you the keys back to your fucking life. And so I hope this helped somebody, because these are important concepts to understand. And if you don't understand pain, it's going to be a rough ride for you, because you're going to be running from it, or you're going to be running into it in a uninformed way without a tempered approach. And you need to approach it in a tempered manner so that you can take advantage of these plastic changes. You can reduce the amount of noxious stimulus that you're experiencing. And again, like I said at the very beginning of the video, it hurts to breathe in my back. It hurts. Right there on my top right, I'd say it feels like about rib 5, rib 5, 4. Yeah. Right in longissimus, basically, kind of towards the right shoulder blade. Hurts. To rotate my, you know what I mean? Challenge capsular rotation, internal rotation on the left, internally, and externally are both extremely painful. To raise my arm out with any weight hurts proximal bicep, because I basically ripped my labrum twice. Not off, because I can still move my arm and everything. It's still attached, but I've damaged it twice. And so there's negative remodeling occurring in that area, but with repeated exposure, slow eccentrics, slow loaded eccentrics, and understanding the tolerable amount of pain that I can take, I can navigate this. Like I have the roadmap, and it's like it's in my mind. You know what I mean? It's not just in my mind. It's like built into me now. It's built into my soul. I know how to get around this stuff. So I'm not gonna go on any longer about this, but I hope this detailed explanation of the nature of pain and what it is helps you kind of understand it better. Because it's not like massage is not magic. It isn't. And you have a lot of responsibility too. And if you don't take personal responsibility for the things that are going on, no one can really help you. You know what I mean? You've got to do some of the work at the end of the day. Yeah, I can help. And I have had treatments where I've gone for treatments, and it was like that one treatment, never had the problem again. That does happen. I'm not going to say it doesn't happen, because it does. But there's also issues that I've had lots of treatments on, and the issue does not ameliorate itself. For example, my back. I have arthritis in my facet joints. That's not going to go away. But I continue to load my spine. People will be like, "You stupid." No. You just don't understand pain. You just don't understand the physiological response to mechanical loading, and you don't know how to go into it in a tempered, mature, informed manner yet. So what I want to do is give you back the keys. The keys are made of understanding. A deeper level of understanding will give you the tools you need in order to navigate these sensations. And these sensations are super important. They're not bad. Like, they feel bad, and they can be interpreted as negative. But we need to change that mental framework. We need to flip that. We need to make that so that this is information. And so we need to go and explore that pain. We need to explore that range. We need to regain that range. And in order to regain the range of my left shoulder, because I have laxity with stiffness. How do you have laxity with stiffness? Don't ask me, but it's just how it works. When you dislocate your shoulder, you stretch all the ligaments. The ligaments don't bounce back. They're not as bouncy as a muscle. And also the capsule tends to adhese. And also there's compensatory muscular compensatory tonus changes in the rotator cuff as well that will inhibit the function of certain rotator cuff muscles, which changes the dynamics of the forces acting inside the joint, which can lead to arthritis, wear on certain areas of the joint, cartilage degeneration, blah, 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 you name it. It can just lead to a myriad of issues. And so, like, what's the way forwards? Well, to try to get the joint to kind of like float through a nicely balanced force distribution so that you can do exercises, motions, and movements and enjoy your fucking life again, or at least just do your job. The minimum is I want you to be able to do your job. If you can't provide for yourself, it's like an animal who can't get food. You're going to die. You know what I mean? So this isn't a joke. This isn't a flex. This isn't anything really except for I'm trying to give you something for free through education. And education is critical. In this business, it's very difficult because you'll see people coming in over and over and like they're like in our society today we have a level of burnout that is unprecedented, and that level of burnout takes away from you the energy and the fucks. You got no fucks left to give. You hope you could just go see somebody and they'll rub you and you feel better. If it wasn't $150 an hour, oh my god, everybody would go to a massage. Like if it was $20 an hour, everybody would go to a massage like all the time. And I just want to tell you this too: if you're broke, go to the college. It's like $40. You got no money, you're out of benefits or whatever. $40. The students are not going to understand it as deeply as I do. Partly because they're still in school. Second of all, maybe they don't have the same level of experience, competitive experience, trades experience, broken bones, torn muscles, surgery, other things we'll say I'm not even going to mention that I've been through. You need to find somebody who's at a higher level of understanding to help you navigate these things so that you can have back control. So that's where I'm going to leave it. That's what massage does. That's what pain is for. Pain is a physiological, adaptive, neurological sensation, and it's very necessary. And if pain didn't exist, we would blow ourselves to pieces just doing everyday things, because we wouldn't sense the time to stop. And just one more thing. When you're young, you can handle a lot more stress usually than when you're older. So where I tend to find people fall apart is like right around my age. I'm starting to fall apart like crazy. And so for my knee, I hear people all the time like, low volume, blah, blah, blah. They talk shit about low volume. And it's like, okay, well, maybe you don't have the same problems as everybody else, because I've gotten great response from sheer stress forces applied in a metered, tempered, intelligent manner. And I paid for it. I'm telling you, my knee would puff up like a marshmallow, turn red. It's fucked for like 2 weeks. As soon as it's good to go, though, my test for it, I'll show you a test. My test for my knee basically is because I get Baker's cyst, right? Baker's cyst is basically an accumulation, a pocket of fluid at the posterior of the knee, pressing out of the joint capsule, and it basically accumulates right around the popliteus. It's a small muscle that basically helps you when your knee is totally locked, kind of helps unlock it. So it goes from completely locked to bent. So basically it pulls, because there's these two bones that kind of lock together. Your femur kind of locks into the tibia, and popliteus kind of pulls it so that it can unlock. That's why you can stand straight with like minimal to almost no effort. And then when you bend your knee again, there's almost like a clunk, right? We're locked. We're locked. We're bent. We're locked. We're bent. Popliteus helps initiate that initial unlocking. So that's an interesting thing. So anyway, what's the test? For me, this is something I found very, very useful. Oh, medical records, fuck off. So this has been the test. I get down on the ground, go down on my knees, and I sit down and I just feel how much fluid is behind the knee, basically. And if it's puffy and it doesn't want to fold, there's fluid, an accumulation of inflammation, basically. If it's at a certain level, I become very intimate with this sensation. So when it's at a certain level, I know it's not time to induce a subsequent stimulus in that plane of movement. However, I'm going to say there's a lot of good real estate still down there, right? Like, okay, it hurts at the knee. So does that mean don't train legs? No. We still have proximal feet, proximal rectus fem, which does this. There's also the deep hip flexors, which help with hip flexion, right? But there's also rectus femoris, which also helps with hip flexion. There's TFL, which helps with hip flexion. There's adductors, depending on which, basically, adductors help with hip extension, depending on your orientation. Adductors adduct. Adduction is bringing the leg towards the body, or the arm towards the body. And then abduction, away from the body, right? So this is abduction, adduction, right? So we can train adduction, abduction. And if you got one area that's really puny and weak, well, there's a ton of good stuff. Like you still have the glutes. like, which is comprised of a number of muscles. Your external hip rotators are basically like, there's 6 of them, I think, if I remember. Piriformis, gemellus anterior, gemellus exterior, obturator internus externus, gemellus, piriformis, glute med, glute min, glute max. That's a lot of muscle. Tons of good real estate. It's your booty. And then there's hamstrings. Hamstrings, they say there's 2 heads. Well, there's the semitendinosus, semimembranosus. There's also rectus femoris. And then there's also short head of rectus femoris, which that's 4, right? But they say biceps femoris, which means two heads. I mean, whatever, we say 2 heads, but it's comprised of 4 muscles. Quadriceps is rectus femoris. Biceps femoris, which is your hamstring. Rectus femoris, which is your quad. Vastus lateralis, vastus medialis, the opposite. What I said, medialis is medial, lateralis is lateral. That's a nice teardrop. The sweep. See how puny my quads are these days? They used to be way better. Anyway, I'm working on it, and I'm trying to build up the quads again. But also, I'm building up the groin. The groin is comprised of, let's just go through them for fun. It's going to be sartorius, which is from outside of the hip, to pes anserine. There's gracilis, which is pubis, to pes anserine. There's adductor longus, which is basically pubis, all the way to pes anserine. That's 3 muscles. Pes anserine is the goose foot, translated from Latin, the foot of the goose. Fun, hey? And then, there's longus, right? Like we were saying, that's one of them. A big one. And then there's brevis. It's like feels like a baseball right up here. There's pectineus. There's also adductor magnus in the back. They call it the 3rd hamstring, even though you've got like 4 muscles that comprise of the hamstrings group. So how many muscles is that aside from just the knee? The distal rec fem? Lots. So what I'm trying to say is we got to focus on what we've got, not on what we've lost, because there's so much good stuff still down there. And like, if your shoulder hurts, yeah, sure. And if you can't do a curl, okay, whatever. But what can you do a hammer curl? Because that's, that's biceps, that's brachioradialis. If you do supinated, hand up, this is like biceps brachii. And then if you do front raise, yeah, it's front delt. That's a little bit pec, but also it's proximal head of biceps. How do I know that? I tore my labrum twice. And slap tear, or slap lesion, we'll say. Still attached because I can still do it. If I couldn't do it, then my arm would be dangling, right? And then I need surgery, but I haven't had surgery and it's getting better, but it's a long, painful, slow process. And I would encourage you to be patient. Be patient with yourself, because these things, like, what's the timeline on some of this stuff? It took me 10 years to deadlift 600 again. I broke my back in 2016. It's 2026. I just pulled 600 beltless, like last month. Beltless, strapless, double overhand. That was a good moment for me. It was after work. I had 30 minutes and I banged it out, but it was there that day. And how did I know that? I'm very intimate with the sensations that are occurring inside my body. I felt that it was there on that day, and I was clear about it. And I was clear about it because I've gone into that sensation so many times. If it isn't there, and it's not there because it's not feeling right, and you're in tune with yourself, this is a really tricky thing, because you have to tune in. You have to tune in a really intimate way in order to navigate these sensations correctly, in a way that's going to help you recover, take advantage of the line of supercompensation, sleep right, eat right, do everything right. It's like for a decade. I'm looking for 700 next. I'm going to get under 400-pound squat soon. I'm going to start with a single and see how it goes. Couple singles maybe, we'll see, depending on how the first single goes. But I don't squat narrow anymore, I squat wide. You know why? Biomechanics. So biomechanics is really critical, because say I do have this damning diagnosis. It's the medial compartment that's wrecked. Medial compartment typically gets wrecked because the medial femoral condyle is extending more distally, which means a little bit more further away from the body than the lateral femoral condyle. This means that the medial femoral condyle tends to take more of the pressure, and so it wears out first. It's like if your tires on your car were like misaligned like this, the outside of the tire is going to wear out before the inside, you know what I mean? Or whatever. Or the inside is going to wear out if it's like this. So if we get that fucker kind of cranked like this a little, Well, there's no tread left on the inside, but we got lots of tread on the outside. And that's what I'm counting on for my knee, is I've switched now back to wide. So I squat sumo. And why? It's because, well, if we go sumo, we're loading adductors, we're loading glutes, and we're offloading quads. And we're sitting back, opening. This feels silky on the knees, but I get a lot of stretch and stress in the groin. And if I really flex the glutes, I come up, no problem. Now when I go narrow, loads quads. Okay. Right away, I feel that in my right knee. Achy, shitty. But I've got a lot of experience with this, and I've been doing this for a bit. Check this out. Check this out. This is pretty cool. I'm proud of this. I'm not going to touch nothing. Ooh, and I'm telling you, it hurts. Look, I'll touch the ground. Hold on, let me get back in there. You know? Well, how did I get there? My knees were made of glass when I got that diagnosis. There was not a fucking chance that was going to happen. I talked about regressions. I did my regressions. I took 5 years and went to school to get out of the trades because that job was just running me into the ground. I had to make a change. I was going to kill myself. If the job didn't kill me, I was going to kill me. My lifestyle was going to kill me. And so I just wanted to demonstrate that we can get around this. And even though I've broken my left shoulder 5 months ago, and, you know, basically that means I've sorry, I don't want to say that word, rocked my labrum twice. It can recover, but I have to be patient. The recovery path might be longer than I'd prefer, but it can happen. It can happen. It is possible to recover. And so with that, I'll leave you. But just remember, you are highly responsible for how this path unfolds. If you take no agency over the path on which you walk, well, you're just a passenger in life. Would you rather have the wheel and steer, or would you rather have someone else steer? Because life will steer, and you might not like where it's headed. So anyway, be strong mentally. Act accordingly if you have a goal. Don't give up. One thing that my journeyman always used to tell me, John, he would always say, don't give up. Don't give up. And he was hard on me, and you know why? It's because he knew I had what it took. And I was young, and I was strong, and I was pretty hard to rein in. But you know what? I appreciate all the hard days he gave me, because it taught me work ethic, and now I understand. At a high level, I understand these things. And so I hope that helps. This is an hour long. I don't know who's going to watch this, but if you're fucked and you need some advice, this is a free hour of me telling you exactly the way through. And so anyway, I'm going to leave you with that. Be strong, stay strong. Don't be hard on yourself if you fall off the horse. It's not about not falling off the horse. The most important thing is that you get back on that horse and you break it again. You break the horse. You don't let the horse break you, kind of thing. So